Moments with Dr. Greta are brought to you by the Ashley Clinic in Chanute, Kansas. Ballin and squawlin at your house? Well, could it be because somebody's taken a fall? Head injuries are a big deal, but we don't really know how to watch for kids under 6 years of age, at least until now. There was an article out of Pediatrics gave us information about mild concussion symptoms 1 month, 3 months, and a year out after a child had an injury. There's more injuries than we thought. Parents need to know what to watch for in the first place, so if your child falls and gets a head injury, talk with your doctor to know if you need to go to the emergency room. If you go there, they may not do a CT scan because we now have a protocol called PECARN, which allows us to know which kids are more likely to have something that the CT scan will show, so we don't overdo those and potentially get too much radiation that might cause cancer. But in the meantime, if your child does go to the ER or has other issues, talk with your doctor about follow-up. There's an interesting protocol called reactions. It stands for Report of Early Childhood Traumatic Injury Observation and Symptoms. It has to do with a symptom checklist of things that we sort of think about, but it's organized, and it allows us to look at the child in terms of how they're eating, how they're sleeping. Are they more grumpy than usual, which is sometimes hard to tell with a child? Are they light sensitive? Are they having any issue with their focusing, their attention? Do they seem to be moving slower or just not mentating? Is something different? It's important for parents to just be hyper-vigilant about watching those things and asking. And that way, then you may be able to find something sooner. So if there's ballin' and squalling at your house because of some falling, pay attention to that and, of course, give that kid a hug.